I get a good night's sleep. So when I'm not sleeping, I'm like, okay, I'm stressed. So then it's all back to what do I need to do to get a good night's sleep?
Sounds
Folks,
good. Thank
before
you,
we
Sandy.
proceed, I need to let everyone know we've turned on recording. I wasn't smart
Oh,
enough to remember
thank
to
you.
do it at the beginning.
Yeah, we were
That's okay.
supposed
Thank
to.
you.
Thank you,
That's
Jim.
okay. Thank you.
So we're hearing that stress is a continuum and it affects different people different ways. We've heard some pretty specific signs from amongst our panel of experts. And I know for myself that certainly resonates as well. I don't necessarily feel it as much in my chest, but I definitely feel it sometimes in my lower back. And also on what Cheyenne was saying about the ability to focus. Sometimes I feel like a little bit more scattered than usual. So we're in the midst of a pandemic, certainly unprecedented in our time. And I know for my caregivers and my employees, we're going out to our clients' homes. One of our stresses that has just become even more so is issues with childcare, because the schools have been sometimes open, sometimes virtual. There's sometimes issues with connectivity in terms of electricity and internet. And it just seems like it's that my caregivers tend to be the ones who are the also kind of in the sandwich generation in between their parents and their children, just more stress because of the pandemic, because of the isolation. What new stresses are you seeing in your family and amongst your clients? And what would be a way that we could start to, categorize those stresses? So sometimes if we name them, then we can start to respond more in a targeted way. So we're gonna sort of go back around the way that we came with Sandy, Melinda, and Cheyenne.
Loneliness. People are lonely, and checking in with people is something that I do and appreciate when people do that for me. That's it, checking in on people and taking care of your loneliness. And sometimes for me, that means kind of just going into it and going, oh, I have time to read now, or I have time to do this or that project. So that's kind of a low level worry, I guess, that I'll contribute.
Sandy, you mentioned, loneliness. And the other thing, a couple of friends have said to me too, that they're big huggers. My husband is like that. Everybody he meets, he hugs, and it's kind of comical because he won't shake your hand, he'll shake your hand and give you a hug. And we can't do that anymore. We can't do that. And I think that physical communication is really important to everybody. We're not able to even shake hands. It adds to that feeling of isolation, I guess, too. And to Shalom's point, some of you who work in facilities, the added stress to the staff, because they are now the family members of the people that are lonely and that are depressed because they're so separated from their family members. So,
well,
Melinda, you want to take it from there?
And that's hard because I work in the assisted living community. And seniors, so if you think about the spectrum, children need to be hugged. We all need to be hugged, but children particularly need to be hugged. And seniors need that as well. And it's very difficult. They don't understand why they can't sit next to each other and talk. They don't understand why their family's not coming and giving them a hug if they do visit, because we still have to keep that 6 feet and mask. So that, even though they can sort of see each other now, they're still in isolation. So we've gone from no contact whatsoever to minimal contact. And now it's being dialed back a little bit, but they still don't understand, okay, they're here, I just want to hug them. I just want to get close to them. So it's very difficult. We do the best we can in our community. We want to keep our residents safe, the staff safe. But we do the best we can to make them feel loved without that physical contact, other than what is necessary for medical reasons.
The other thing I think that is really, really stressful to administrators and to staff is trying to figure out what's the new rule from CMS today, right?
It changes every day.
Oh, I just read the whole thing about now they're saying 7 to 10 days instead of 10 to 14 days. So it's like
we got those directives yesterday from the County Board of Health.
Yes, yes.
But yet
CMS
they've
just came
stopped
out with
extra
that.
surgeries now too, so.
Right, right. So, you know, in the very beginning especially, it was just ridiculous because every time and not only are you getting different messages from the state sometimes and from CMS, but also, you know, they are not stopping the regulatory process either, right? So they're still coming into your facility. They're still going to cite you if there's any infection control issues. So it just adds, in the middle of a pandemic, in the middle of the isolation, it adds all that much more stress onto
does.
everybody.
Mhm.
Yeah.
And our
So-
caregivers in our community, they have all the stressors of that. And then the home
Mhm.
care, their own
Right.
family members, they may be taking care of their children homeschool. How do we do that? One day they're
Right.
in school, one day they're not. One day they can go to daycare, one day they can't.
Mhm.
I'm sure that the other panelists, you know, they know people or have people that work for them in the same situation.
I'm
Well,
actually experiencing that now, Melinda. I got a call yesterday from the Board of Health that my 5-year-old was exposed to someone in daycare that tested positive for the
Oh, God.
COVID-19. And so now it's like this whole, you know, domino effect because I'm like, okay, well, now she can't go to school. How do I handle with my younger child that's 3 years old? Is she allowed to go because there's contact at home? I have to make arrangements to do virtual doctor visits with her now, and my mother who helps out with her so that I can tend to the business. She's a breast cancer survivor who's also taking care of my older sister who's in stage 4 breast cancer. Now my mother is like, you stay away for like 3 weeks.
Yeah.
So it's difficult, and it's like it's a huge domino effect, you know. So and
And
everything
then-
has changed because the doctor says not 14 days we wouldn't have to do, it's 10 days, and she's not even really that concerned. They won't order her to get tested because my daughter doesn't have the symptoms, so they say just
Right.
watch her and you probably should be fine 7 to 10 days. So you know, it's definitely changing.
I have a quick question. Does your daughter feel that stress? Does she have stress reactions that you try to help her with? Or does she not really realize it?
She does. You know, she actually is a lover. She loves to hug. We actually dealt with a situation, I think, right after the pandemic happened, and she had a ear infection. We were at the hospital. She wanted to hug the nurse, and the nurse freaked out and like was running away from her. She's 5. She doesn't understand, you know.
Right.
So having to
Wow.
explain that to the little one, you can't touch people, you know, don't get too close. It's very difficult. She doesn't understand that, you know.
Mhm. Let me bring in Roman and Nathan, the same question.
Roman, go.
Go ahead, Nathan.
Okay. Well, one thing that this reminds me of is something that's really important to the work we do in hospice, be it our clinical staff or our paid staff, our volunteer staff, is, you know, providing presence for people who are, you know, be it separated because of where they live or because of a diagnosis or because of COVID, finding ways creatively to provide presence, just being there for someone, be it through the phone, through FaceTime, through Zoom, is something that we're really struggling to make work, as well as just, you know, being able to hug somebody, as Cheyenne said. You know, that's something that, you know, being able to sort of piecemeal put together ways to be present for someone, for people, for each other, has been really helpful. It's not the same, you know, it's like a little taste, a little sample you get at Costco versus the whole bag, but it's something, and it's been very beneficial, you know, to a lot of the folks that are our volunteers, that are our patients, that are our caregivers. So, you know, just figuring out ways to keeping presence available for everyone, I think, is a great way to try to overcome some of these stressors.
Nathan, can you speak to, before we go to Roman, can you speak to one of the things I think that is so devastating is that, I mean, I've had friends who have lost family members, and a lot of times they can't be present with them when they're dying. I know a lot of the hospices have made some concessions. Some of the hospitals will not, but I can't even imagine someone telling me that I can't be there with my family member, God forbid, dying and I can't be there, I would storm the doors. I mean, there's just no way. So how do you manage that, and how do your caregivers manage all that?
Sorry about my phone in the background.
It's okay.
Well, the joys of working from home, just like we're talking about. One of the ways that we've done that is we do have very I hate to use the word strict, but very thorough processes for visitation. So if a person is in one of our hospice facilities, there are ways to have visitors. For the hospital-based patients, it is really challenging. I can't speak to what the visitation policies of each hospital is currently. I know that they're tightening up back to the way they were in the spring, early summer, late spring. And really, trying to provide, not to use technology as a crutch, but maybe as a Band-Aid, to at least have some form of visual contact with the person who's in the hospital is one way. But I mean, so often what we're doing is, bereavement services for the families that can't visit with the loved one because of all the visitation restrictions. So, it's really difficult. And I think a big part of what we're trying to do is be as supportive as possible of those who are in need, the best ways we can, within the rules. And the rules are tough. So it's really strict. It's really hard. There's no silver bullet, magic wand, wonderful, solution to this. But we're trying to be as supportive as we can to those people in need.
I'm sure they appreciate it. I was also thinking, can you imagine if you're not present when a family member passes, and what kind of guilt are you can have after that? That's a whole nother ball game.
Sure.
But
no, I didn't mean to interrupt. I'm sorry.
No, that's okay. That's okay. Appreciate your insight. Roman, you wanna chime in too?
Yeah, I was in these shoes. My father passed away in this August in Menora Park, and they was allowed me to be with him last 3 days. And I understand what hospice doing, because I was volunteer for hospice for over 16 years. So yes, it's more important, but with my customers, my clients, I just always mention, it's not social distancing, it's physical distancing. We still need to socially connect, support each other. And if Shalom or Melinda can put my information in chat room, because I was not able, I'm on cell phone because I'm in Geauga County and we still have power problem. So I use my cell phone. I cannot log into internet on my laptop.
Mm-hmm.
So just another
So you
thing.
can do that.
My last blog post I was posting about how we can celebrate together with family in distance, different tips and suggestions. Because now my kids outside out of state in New York and New Jersey. So it's Thanksgiving, Christmas, all this time when we all together, and this time we cannot. So we just create new things what we never done before. Family movies, family game nights. When everyone on their device, we together but in different places. So we can be creative, so it still can support and help each other go through this.
Excellent. I was thinking about all the different specialists that we have here on our panel, and I was thinking about some of the ways that all of you help us to de-stress. So obviously Cheyenne with the massage. We have physical movement, Sandy with you with yoga, and I think physicality and exercise, increases your
endorphins.
Thank you, endorphins. Thank you. So neuro something or other, endorphins, yes. And with the Reiki, obviously, Roman, I've done Reiki before. I'm not a master, but I've done that before, and it definitely makes a difference. And then the mental health piece too, Melinda, that you provide. So if each of you could talk about, how you support people specifically with your talents and how we could benefit, because again, this is for all of us, right, as care providers. And I think sometimes, I know as a nurse, through the many years that I've been a nurse, I used to work in intensive care, and there were some times where things were so, for lack of a better term, intense, that we would laugh. I mean, it was not a funny situation, but it was the way that we could relieve our stress. You know, we would become sarcastic, and that was our way. And it wasn't that we didn't care; we certainly cared deeply. But sometimes you just had to blow off steam that way. So if each of you could maybe talk about how you, in your specific ways, so like Melinda with Heart Mojo and the podcast that you do, you know, we can start with you and how
Okay.
your specific specialty helps people with their stress. And you can
So
help us.
I never anticipated getting into that area, though I do have a background in psychology. That's what I went to college for. But I started out with exercise and putting together a social media page talking about exercise. And Sandy and I have known each other for many, many, many years, more than I didn't even realize till the other day. And so she knows I was into that, and that was very motivational, and I would help people face their physical challenges that way. Then I developed breast cancer, and there was a switch. And so my social media became, how do you get through this life's challenge? How do you mentally get through it, physically get through it? And I shared that journey on that page. And by sharing, it helped me cope. It wasn't just about helping other people, it was about helping me focus on being positive and the good things and laughing at the bad things, right? So, and that led to a podcast. Somebody who followed me said, look, I think, you know, you can help people by talking about life's challenges. And though it started out as a cancer challenge, we've had many other people on talking about different challenges because, you know, hopefully no one ever has to go through that. I would never wish that on anybody. It did give me a different view on life. And I think it has helped me through this process with COVID and the things that we're going through there because I've already been through that type of journey. Laughter is super important. I went even if I had chemo, I went to the comedy club. And because of that, I also started an event, which for right now, COVID has put on the sideline called Don't Forget to Laugh. And I have comedians that donate their time, and those proceeds go to, right now, the Alzheimer's Association, though it can be used anywhere. So for me, I think I use my social media platform not only for myself, but for other people. So focusing on the positive things, remembering we all have something. And if I'm working through it, you can work through it. And having somebody tell you that. You know, we have a lot of different disciplines and everybody has their specialty to hit that piece of the body because we are a physical body, we're a mind body, and we're a spirit body. And so we each touch on different areas, but yet they all are one. So for me, it's not really the physical, it's more spiritual and mental, working with people.
Very good. Cheyenne, how about, can you talk about massage therapy and how that helps with stress?
Yes, I guess I can begin by saying I entered into this industry because I genuinely love to help people. No matter what it is, I just enjoy. For me, that's my healing, is to be able to help someone. And just overall massage, which is what my overall goal is, to reach so many people, because so many people still do not understand how important massage can be. It's not just a luxury. It helps on so many levels. It helps with just touch, period, helps with stress, you know, just to be touched, which is important right now, right? Because nobody, you know, everyone's afraid to do a handshake, you know. It helps decrease anxiety. It helps to lower the heart rate. It helps to release those stressors called endorphins in the body. So there's a lot that's going on with the massage. I have so many clients that when they lay on that table, I never initiate any conversation. I always allow my clients that time. But if they want, it's like therapy to them. I get clients that lay on the table and they just start talking. And for them, that's how they are able to get stuff out, you know, while receiving their session. And it's all, you know, all over the place. Maybe they've had a death in the family, or, you know, they talk about this, you know, from COVID to the election, you know, all across the board. But the massage, it really does help on a physical matter, you know, just to help people to be able to just, you know, to just relieve stress, period. So in a nutshell is what it is.
Great, thank you. Roman, you want to talk a little bit more about Reiki? I mean, I understand it because I've done it before. It's pretty amazing. And I know you can do that even remotely. I have a lot of friends that have done that. But if you could talk to us about how that relieves stress.
Yes, it's because we know we all energy bodies. It's how our body, how our inner organs communicate with each other. Why we have a EKG or EEG, just to register these electrical signals from brain, from heart, from different organs. And when it's with stress, communications, energy flow in the body, it can be disrupted. So what I'm doing, I'm helping restoring natural energy flow so body can heal itself, because our body have unique ability to heal each other, itself and restore itself, because we have, when we have I don't know, pepper cut, we not go put stitches, body heal itself, and with many different things. And especially I would emphasize what Melinda say. It's about laughter, because laughter is, in my experience, it's most natural and inexpensive way to boost our immune system. Why it's so important. And in my practice, to my clients, I always say you need to have at least 30 minutes, 40 minutes left every day to laughter. Just on your break, go on YouTube, watch stupid cat movies or videos. During weekend, have comedy watching or something, because it's a boost immune system. And also, I would like to emphasize, sometimes when I have clients, I not work with so much with clients, how much with caregivers, because they have a lot of burnout, because it's not my 8 to 5 job. It's sometimes they take care of loved one 24/7. And we talk about self-care, because it's self-care, it's not selfish. When you're healthy
Right.
and you're in good shape, you can provide better assistance to your loved one, or to your work, what you work if you're a caregiver. So just sometimes now distance, and when I was in person, I working not just with clients, but with the caregivers, because it's most important, because sometimes I see and feel was a person was the care of. So sometimes we need to really pay attention to people who provide care more,
Right.
because sometimes they just neglecting themselves.
Right. You know, it's interesting you say that. I'm working with a client right now, and they really need help from people like Shalom's group, for example, and they're refusing it. They're worried about COVID, having somebody come into the home. And I think, and I've done this before myself, you put yourself out there as the hero. You know, I can do this. I can do this. It's important that I take care of this person. And, you know, we forget what a toll that's taking on us, right? We think we're going to just get through it and then I'll be fine. And sometimes it's not okay. So,
Well,
Sandy,
Roberta,
do you wanna-
before I just want to throw this in with that. That's one of the things I focus on. You know, people think I never have a bad day. People think, oh my God, you're positive all the time. It's important for me when I share, and I'm sure with everybody else here, it's okay to have a bad day. You're human. It's very much okay, and then move on from that. But if you hold that in and you are trying to be the superhero, which is the problem I think many of us have in our industries and in our life, we're our superhero for our parent or our work or our child. It's okay to have a bad day, and it's important that people know that.
Yeah.
Right. You know, you bring up something that I was just thinking about too, and that is self-talk, you know. So if I want to say something negative about myself in my own head, it will happen, right? I need to change that thinking into positive things. Sandy, do you want to talk a little bit about movement? I mean, I was a certified fitness trainer, and I know that I got, you know, people talk about the runner's high. I'm not a runner, but you know, that endorphin rush that you get from working out. I think at first it starts out and you just hate it. And then you get to that point, you cross that bridge where you get to that point where it really is important and you need that daily exercise. So can you talk a little bit about your practice and yoga and physical movement?
Yes, my business is Move Well Education, and it's exactly that. I basically teach people how to think like Melinda. It looks like yoga and it looks like exercise, but really it's about getting someone to think bigger about what's possible for themselves. Do you remember when Apple Computer came about in the 80s? I mean, it started before then, and no one believed they'd have an iPhone in their hands or a personal computer on their desk. And their big advertisement was about thinking bigger, getting people to think bigger. That's not where people are at right now with movement and exercise and fitness. Exercise needs a rebrand, so to speak. I teach people how movement, and it doesn't have to hurt to work type of movement, can really upregulate how you feel, your health. So I get people to think bigger about it, and don't call it exercise if you've failed before at being consistent with that. I encourage people to put a dumbbell in their office and take a movement snack in between phone calls. And just doing just with a 10-pound, it doesn't have to be your usual 50-pound dumbbell that maybe you used to do 20 years ago. Just get a 10-pound dumbbell and do some rows and do some pushing and do some squatting. Everything upregulates when you move. I mean, even we know this, when you have heart surgery, they get you up moving. When you have hip replacement, they get you up moving. When you have a baby, they get you out of the hospital. They want you moving. Movement heals. No longer in professional sports. In most professional sports, are they using ice anymore? To get people moving with an e-stim machine, or they get you up physically moving. This is why you're seeing certain NFL players get back to sport way quicker, because they're using movement and therapists like myself to get them back on the field. It wastes time and it slows down healing when you throw an ice pack on something. Now, if I was a first grade school teacher, you better believe I'd be giving kids an ice pack, because it buys me, the nurse, some time to deal with lots of kids. It takes pain away. But as far as healing, it slows it down. So we know more now about so many things, that I teach people that what we know in professional sports is for all of us, and we can scale that. I teach people how to scale that. You might not have the resources that a LeBron James has, but people like him are playing sport well into their late 30s and even 40s in football. And we can do that. We can age better. So that's what I teach people.
Athletes today are just amazing.
Andy, why it's so hard for some of our clients when they're in the hospital and they're basically lying on their backs and they're deconditioning, and why that is so dangerous, and why the hospitals are now trying to bring the therapists in as fast as possible to help, even if they need help moving, to keep those things flowing.
Mm-hmm.
I just have one other thought about this. We talked about the massage, the physical movement, the yoga, the mental health, and the Reiki. Nathan, is it possible for you to talk a little bit about the spiritual aspect? So I would imagine, I don't want to get heavily into religion because everybody has different religious beliefs, but I think spirituality is another component of how we, help ourselves. You're muted, Nathan. You're muted.
There you go.
Oh, there you go.
Am I better? Okay, sorry. With all the noise, all the phones going off in the background, I thought I best mute. I apologize. I wish my handwriting was better, because if you could see my notes, it actually says spirituality is what I wanted to bring up. So that's perfect.
I'm reading.
Well, what I think is important about the spirituality piece is that it really has to do with the individual's relationships, their relationships to themselves, their relationship to a higher power, their relationships to other people. And so much of this stress that we're feeling is because we can't have traditional physical contact in relationships, but we can still maintain those relationships. And I think that, I think Roman's point, it's not physical distancing, or it's physical distancing. It's not distancing from people. It's just proximity that we're talking about. So we're trying to keep those connections with people, keep those connections with faith, keep those connections with spirituality. And a lot of times, a lot of folks have great interpersonal relationships through their spirituality or through their faith as well. So I think that's really a vital component of managing and dealing with stress, is for people who's that's a strong part of their lives. That's something that we really need to not forego and not lose sight of, what we need very strongly to maintain, because it's a relationship that's so vital and so nuanced and so faceted for so many people, that spirituality is a vital way to manage stress. So I think I'm so glad you brought it up. Thank you.
Sure. Of course. Yeah. Shalom, do you have another question?
I do. So we've been talking about how we see the stress in ourselves, how we see the changing stress amongst in our community and amongst our clients. We've been talking about some of the different modalities that we access in terms of addressing some of those conditions. Okay, so now I want to ask a little bit about us as leaders in our communities. So oftentimes we're maybe business owners or employers. So when people come to us for leadership, can they see that we're carrying added burdens during this time? And is that okay? And Melinda started to touch on this a little bit too. It's okay to have a bad day. And how can we do this and still instill that confidence in others that we're going to continue to be there with them and for them. So we'll go back around, starting with Nathan.
I unmuted that time. One of the things that I think as leaders goes is that we have the opportunity as leaders to provide education in the community. And maybe it's not formal structured education like a Zoom meeting like this, but it's definitely one-on-one interpersonal education and teaching people things like, what is real self-care versus what is artificial or fake self-care. So, saying to a person, a person may say, I'm going to go on a diet. I'm going to try to lose weight, and find out, is that just for vanity's sake, or is that something that's very health related, and reinforce the health related component of it, as opposed to the, boy, I'm going to look good in these jeans when I lose 30 pounds. But it's also a matter of saying, well, you're also going to live longer. You're also going to be less stressed. You're also going to feel better. And so really being educators in the community, I think is a right and a responsibility that we have as leaders. And I think that's really, the heart and soul of so much of what I try to do personally in my role, is educate clinicians, educate volunteers, educate even patients and caregivers and family members about all the different things, ways of looking at life, ways of looking at time that we have to make it less stressful and more vital and more fun.
Very good.
Bring in Sandy and also Cheyenne.
Can you refresh with the question again?
Yeah.
Okay, so how do we show that it's, for example, okay to have a tough day? How do we continue to show leadership and caring while we ourselves are carrying perhaps a heavier burden?
Well, from my perspective, I don't share a lot of personal stuff on social media. I have a major life health scare I had years ago. I eventually got the courage and the words to write about it. So I have a blog about that, one blog post. I'm a septic shock survivor who was hospitalized for 5 weeks and had a mitral valve, heart valve replacement, and I had spinal surgery. And I'm one of the lucky ones who have survived severe septic shock. So I wrote about that. But day-to-day things of stress, I don't know that I share too much. I share mostly solutions to problems. I just try to live by example and share ways to handle stress. I don't live my story. What's the person's work? Radical acceptance. I accept that, but it's over here and it doesn't define me anymore. So I continue to share what I did to recover from something like that. In fact, I have a program online called Driving School for Your Body that teaches people, it's kind of the operating manual for the human body that is not taught in fitness and is not taught in yoga. There's elements of it, but how were humans designed to move? How did you go from being an infant to a toddler? So I teach through movement how to manage yourself. So I don't always share day-to-day stresses, but I have in the past. Does that make sense?
Mm-hmm.
And when you mentioned driving, like I was super stressed the other day. So here's an example of, so I'm trying to share also leadership with my teams, right? So one of my team managers was like, I have 2 caregivers. They're not going to be able to get to their clients. I can't send them a taxi or an Uber or anything else. They're not responding. Nobody's moving. I put 50 pounds of rock salt, basically ice melter, in the back to make the car heavier, put in a bunch of shovels and some other things, and went off. And it wasn't just picking them up, but it was also digging out the caregivers who they were relieving, because their cars were totally covered over as well, and they needed to get back home. And so I felt like mitzvah gorer, mitzvah in Hebrew, but I felt like one opportunity to help somebody else led to another opportunity. And then they also had a chance to talk to me to say, here's how I think that our company is going. Here's how I'm making my clients' lives better. Like I got different perspectives on some of the things that they're looking at. And they like to see that, hey, everybody's in this together. We're all caregivers. So you mentioned driving. That just triggered that for me. Let me bring a Cheyenne in. So when you talked about, giving your clients, Cheyenne, an opportunity to be on the table and enjoy that session, and perhaps they want to be maybe meditative and quiet, but maybe they also want to share. How are you able to continue to share your leadership and not unburden with them when you're facing, children at home with COVID exposure?
Yes. So, when I bring girls in and I train them estheticians or therapists, I always tell them we all go through stuff. Everybody has issues, problems. Everybody deals with something. But in the nature of our industry, I tell these girls, leave it at the door. We got to try to come in here with our happy face as best as we can and try to, present this positive energy or image to these clients. And like Sandy said, finding solutions. I don't think I exhibit any type of frustration when I am going through any type of problems or issues. And I think that's why my team, they really acknowledge that and respect that, because I am a problem solver. So normally what I'm doing is realizing if there is a situation or problem, is realizing that, and also understanding there are some elements that are out of our control. You only can control what you can control, and some things you can't control. For example, we have no power, we have no phones, no internet. And my office manager called me this morning. She's freaking out. She's like, we have no phones. And I'm okay. I'm like, okay. It's okay. We'll call Spectrum. We'll have them transfer the calls internally to your cell phone. And then she goes, oh, okay. Yeah. Okay. That'll work, And then I tell her, put our scheduling. There's an app. You have it on your phone. And she goes, oh, okay. You're right. And, and so just trying to problem solve through that and just take a breather because, like I say, we can't control this outage that we have, but we can still control certain things. So I believe, like what Sandy, I agree, just finding solutions to continue to be that leader, because if I fall apart, everybody else falls apart. And so so are the clients. If I fall apart in the session while they're on the table, then they're going to fall apart too.
That's really excellent, Cheyenne. I really appreciate that leadership. It reminds me of in my own self when I was a VP of clinical staff at a nursing home. The state would come in and everybody knew that I was stressed out. And I really had to learn, because I'm the kind of person that, I'm one of those people that I have to watch my face, because you're going to see exactly what I'm thinking right on my face and in my body language.
Yeah.
So I really had to learn how to calm myself down and how to present myself with my staff so that they stayed calm, even though, we all knew it was a stressful situation. Everybody knew that, but they should never know that I'm stressed out at the same time, because I'm their leader. So it took me a while to kind of mature into that type of leadership. So your point is really well taken.
Thank you. Yeah.
Roman.
Sure. Go ahead, Roman.
Roman, Melendez, please.
Yep. I just mute myself. Yes, like Nathan said, we all educators. So for me, it's most important especially in this time, it's mindset, and it's big deal, because we can see the situation as a stones in our way, or we can see this as step stones, what we can walk and be winners. So just just one example, I have my clients who working from home in stress and everything, really take over. And we talk about this. Okay, you're not driving from Chardon to downtown Cleveland. So now you have at least 40 minutes free. So it's time for you walk around the block this 40 minutes, make some movement and work on your stress responses. Because it's everything what negative happens sometimes, it's also opportunity. And our mindset, how we can see the situation, with affect our health. So just for me, it's just find silver lining in everything and helping my clients see some events from different perspective. Because everything on everything we can see few points of view. So we can choose. We will see everything like terrible or everything is perfect. Nothing is miracle or everything is miracle.
That's
Point,
That's
Raymond.
actually perfect intro to roll right into what I was going to say, because it's a choice. So when I'm online, when I'm doing Heart Mojo social media, from a leadership aspect, I want to help at least one person that day. So whatever I can put out there that shows them they have a choice, that shows them the silver lining, or even that it's okay to have a bad day and then move on. If I can help one person, that's my goal from a leadership aspect with my social media and podcast. From a work aspect in the community, I think it's acknowledging the fears of the additional stressors for the staff. You have to respect their feelings too. And they have a job to do. We all have a job to do. But that fear can be overwhelming, as Roberta pointed out, that, she couldn't really show that. And I think the leaders in our community have to acknowledge the other people's fears, that it exists, and then congratulate them or say, look, you're doing an awesome job. You are a superhero. The very first thing I did when I started at this job, which was in the middle of COVID in April, is acknowledge Superhero Day. There was literally there's a superhero day. So I bought superhero things. I wore sparkly red tennis shoes. I got them cupcakes, and I got superhero not only for the staff, but for the residents, because they're superheroes too. I mean, they had to give up a lot, and they're there, and they don't have their family. So I think leadership, yes, you have to be at the helm and you don't have to show the fear, but you can also do things that acknowledge what they're giving up or acknowledge their fears and how to make them feel valued. I think feeling valued is a big piece of the puzzle,
Yes.
in an environment.
We all want to matter. We all want to make a difference, right?
Mhm.
Shalom, we're hitting about
We have about
Yeah.
5 more minutes in our call, so it's about 12:25. I do want to be respectful of time. I also want to give our other participants a chance to introduce themselves a little bit, and maybe I'll ask a question like this. So we've heard from 5 experts that are also very much human and coping with different stresses the same as we are. What is something that we're perhaps taking away from this call that is actionable today? Like, I heard what you said, Sandy, about movement, and I'm gonna get up and dance a little bit and laugh after the call, Melinda. So, like, what's something that I can do for myself that will help to make this more livable? So we'll just let folks jump in unless you want me to call on them. But I see Rosalind and Jim at the top of my screen, so please jump in.
I'll jump in. If I can leave you with one thing, it's worth your time to learn more about your amazing human body. And under that umbrella, I also mean your mind and your spirit. It's all contained in your body. So the more you take a look under your own hood, the more you really respect and appreciate and learn how powerful you really are. And everything from sleep to eating right to movement is aimed at supporting your amazingness. And you're anti-fragile, you're robust, you are meant to survive chaos and disorder. In fact, you're meant to come back stronger. So believe in yourself.
I will.
Rosalind, Jim, Katie, Cindy.
I particularly like what Cheyenne said that Roberta seconded of figure out what you can do about it rather than freaking out about what went wrong. I think of it as don't be Chicken Little. Oh my God, the sky is not falling. The sky is not falling. What are we going to do about the sky looking like it's falling? Because there's usually, I can't say always, usually a workaround. And if nothing else, the workaround might just be, like Roberta said, step back and take a breath, or go a little farther and meditate. But the sky is not falling. And if it's going to fall, there's not a damn thing we can do about it anyway. We're all going to be gone. But, Mother Nature's mad at us. So
The thing is if Roman said about a stone being in the way, being in your way or using it as a stepping stone,
yeah,
maybe it's in your way for a reason. Maybe it's there to move you to a different path. I know most of you on the call, but I know a few of you, boy, you had big stones. I had a big stone in my path, but it put me in a different direction and a better direction. So I think instead of looking at it as the obstacle, the stress is the obstacle. What has been echoed here is look at it as a way to move forward and a different path that might be better for you in the long run.
There's another thing I wanted to glom on to that. I will mess up this quote, but it's from Mark Twain. I've suffered many a tragedy that never really happened. Right. So sometimes I do this, I'm so worried about something that's going to happen in the future and it doesn't happen. And, it's like my son, when he was younger, he was traveling around the country and I would worry constantly that he'd have an accident. And of course, now he has a child and he thinks differently. But he said to me, Mom, he goes, your worrying is not, if God forbid something happens, you didn't prevent it. And if it didn't happen, what's the point of stressing yourself out like that? And I said, yeah, you're right. Intellectually, that's true. But really internalizing that and not worrying about the future and being present right now and dealing with what you have to deal with now is really important. Rosalind, you want to go next?
Yes, and that was what I was going to say as I was listening to the whole panel discussion. I think it was Melinda. It was either Melinda or Cheyenne that was talking about it's a choice. You choose to be positive. You choose to be happy. You have to take a look at what's going on, and it's going to go on whether you make a decision to jump in or not, but choosing to keep yourself on a different course. And I always reflect on what I heard going to work in the 70s. Remember Fulton J. Sheen? He always said, nothing's either good or bad, only thinking makes it so. And we tend to take things that come into our lives and blow them up and, make mountains out of molehills and get all stressed out. And at the end of the day, that problem is going to exist whether we've done anything about it or not. But we're in a tizzy and our bodies are in a tizzy. So I always look at, stay on the positive side. Yesterday was a very, very, or could have been a potentially very stressful day for me because I was trying to get out. I was trying to find someone to come and plow me out of my drive. And I just sat back, took a few deep breaths, and I turned it over to God.
Sounds good. How about Katie? You want to go next? Katie Comer?
Sure. So the one thing that I take away today from today's panel would be self-care. I'm always trying to fix and do everything else. So I feel like for me, that's one aspect that I lack in. So I feel like if I could just remember that and take a deep breath, I could be better in all aspects of my life. So self-care.
Great. Thank you,
when all
Marcia.
else fails, you can kick your kid.
Yeah.
Yeah.
Watch your foot, though.
I know.
Yeah. Marcia, you want to go ahead? You're muted. There you go.
So I have a background in movement teaching silver sneakers, and I have to remind myself that I need to continue moving, even though my job has put me more, this new business has put me in a more sedentary area. So, and I also, from what I heard, the cat videos, I don't watch cat videos, but reminding myself that it's okay to watch my Hallmark movies if I want to. So.
I am not
There you go.
ashamed to enjoy TikTok every day.
Right, right. There you go. I like it. How about Cindy Cardwell? You there? Cindy, you there?
Or
You're
Amiri
muted.
or Shara.
And we have Lori. Oh, there's Shara.
There's Shara. I see Shara.
Sarah, you're muted,
muted.
Sarah.
There she-
Hi, I'm Shara Inat with Kemper House, and we're in Highland Heights. We're Alzheimer's and dementia care. And I'm sorry, did you want any more information or?
Just feedback on is there any takeaways from the self-care and managing your own?
Yeah, I think particularly people who work in our industry, caring for others, are the last ones to take care of themselves first. So I think this is very needed and appreciate this. I think we could use more and more of these type of topics, especially during this time. Thank you.
Sure. Mary Norris Pack, you there?
Hi, everyone.
Hey, how are you?
Mary from Aesop and Benjamin Rose. And like many of you, I can handle everyone's problems. Even the city of Cleveland who cannot figure out a way to properly snow my street. I was out there on the apron with a pitchfork yesterday.
Oh boy.
So my kids have to remind me that, guess what, Mom? You shoveled for 7 hours and the snow still came down. And what happened? You're sore and the snow is still out there and everything got canceled. So self-care, I am with Katie that 2021 is gonna be, take a breath and be okay with taking care of myself first. Everyone always comes first. I might not even like you and you come first. So 2021, people that know me, Mary's gonna take a little first. And this was awesome. Thank you, all the panelists. What an awesome job.
We have Lori.
Very good.
still. Lori Steiner.
Lori
Yeah,
Steiner.
Lori, go ahead,
Hi.
Lori.
I might be the last voice of the day, but my signal when I get too stressed is I get hiccups. I've not heard anybody say that, but I get hiccups
Oh.
because my whole body becomes upset.
The breathing.
So yeah, it's got to be the breathing part. So it makes me take some deep breaths and hold them. But it's the self-care, just like the last few people have been talking about. I take care of my clients and I'll stay up, work late and I'll do all these things, but I don't take care of me all the time. So it's just a good reminder. You got to hear that sometimes if you're like that, to remember to walk the dogs and do some exercise and get good sleep at night.
Sure. Thank you. Cindy, are you there? Cindy Cardwell, you there?
She might have walked away. Nathan didn't.
That's okay.
Nathan didn't speak either.
Nathan, any parting words?
No, I think that the self-care piece is really the vital component, and the whole theme of the presentation, I think, sums it up brilliantly, is to put your oxygen mask on first. Make sure something that we instill in so many of our caregivers, both professionally and family members, is if you're unable to care for your loved one, you're not able, you're failing. You've got to make sure that you're okay first, to make sure that you're able to care for the people you care about. So that's really, I think, at the heart and soul of the entire discussion.
There's one more thing I wanted to wrap up with too, and that is I work with a gentleman named Stuart Musinski. He owns a company called Project Love Values in Action. Many of you may know him. And he started a program called Kind Land in Cleveland. And the whole idea is that, and I think we've discussed this, we don't know what somebody else is going through in their day, right? We don't know. We can put a smile on our face, we can be happy, but you don't know what somebody's going through. So just be kind to other people and respect the fact that you don't know what's happening in their world, right? So
we didn't have,
I'm sorry,
we
Melinda,
didn't have last words from Cheyenne or Roman, actually.
go ahead. Go ahead, Cheyenne.
I guess I would like to just throw in there, you guys are all pretty much absolutely right. It's just taking that time for yourself. And I think COVID, everybody looks at COVID like, this bad thing that has happened, but COVID has also brought in some good things. And I think one of the good things is literally pausing in our life, right? Because we had this shutdown, everyone's at home, literally taking a pause and being able to think about so many things in life. And, you know, as I know everyone else is busy as well, but I know me, I'm go, 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 nonstop. I didn't know what to do with myself. I was sitting at home like, I don't know what to do. And so it's like, okay, sit down, relax. So I started to make body butters because the company went out of business. So I was able to do these body butters, put them online, sell them. I realized that family is important. So spending that extra time with my kids, my son was in a horrible car accident, left him in a coma, almost lost his life.
Oh my
So
God.
it just made me realize how important family is. And I didn't take that time before, and it was very precious. And, you know, so I appreciated that time. It made me realize as I wanted to expand my business, maybe I don't need to expand my business and get 7 and 8 more treatment rooms. You know, we don't necessarily need, a lot of businesses realize they don't need to have people there to work. You know, people, they do better with them working at home. So I think it brought, you know, a lot of good things where you just pause, take a breather, think about what you need, and it's so important to take that time for yourself. Whether it's, if you go get your hair done, my favorite thing about getting my hair done is the shampoo part, right? Because they massaging. I don't care about, you know, they don't even have to style me, just shampoo me, send me out the door. So, you know, and so whatever that may be, everybody has their own moment of, if you sitting by a window drinking a cup of coffee, you know, so it is very vital that people take that time, you know, for themselves, you know, and I think that goes into what we talked about today. Put your first oxygen mask on.
Roman.
Mm-hmm.
Roman gets the last word, I guess.
Roman, the last word for our,
Okay.
for our session today, please, from our
Thank you.
Reiki master.
Thank you. I just want to remind everyone this in this care industry, I'm working with your industry for a long time, and I would love to have more connections and help caregivers to stay healthy. And when we put up program when it's helping with decrease absenteeism and increase retentions and happiness and morals in the business. And also for everyone, please take care of yourself. In one of the things, be aware of your diet. In your diet, it's not just what you're eating, it's also what you're watching on TV, who you follow on social media. Everything affects our emotional, mental, and physical health.
Mm-hmm.
Great point, Roman. Thank you.
Thank
All
you,
right,
everybody.
Shalom, shall
Thank you to our
we wrap
panelists.
everything up? Thank you to everybody, to our panelists, our experts. I think this is really excellent, helped me, and appreciate all of you. And if you, I know this recording, Jim, you'll have on Cleveland East Senior Network, so it can be viewed if you want to share it as well. So thank you, everyone, and have a great day. Be kind and take care of yourselves.
Thank you.
Thank you.
everybody.
Thank
God
you.
bless, my
Have a
friends.
good one.
The board needs to
Well-
stay on for Cleveland East.
Oh, okay, very good.
Bye.
Bye, everyone.
Bye-bye.
Bye. Just you.
So Melinda, you said you
Wait,
wanted to
well,
talk to us
Cheyenne's- there she goes.
for a minute about.
Oh, yeah.
Oh, it actually
What's
isn't
up,
just
guys?
Mary, you're there, right? Oh, look at
Hey.
you.